I'm Samantha, and I'm going to be your nurse today. Today I'm going to be doing a head-to-toe assessment on you, and it'll accumulate of me touching and moving different areas to make sure that everything is normal. Could you tell me your name and date of birth?
Jennifer Gray, 5/1974.
Okay, do you know where we are today?
Rasmussen College,
And the date?
August 28th, 2019.
Okay, and do you know who our president is?
Trump.
Alright, so your patient is oriented to time and place, speech is clear, posture is erect, and hygiene is appropriate for age and weather. Alright, could you stand up for me and walk to the board? And on your way back, could you do heel to toe? Alright, and before you sit, could you put your feet together and your arms to your side and close your eyes? Okay, and you can sit. So, patient has no limping and range of, balance is okay. Now I'm gonna check your capillary refill. Your toes also. Okay, capillary refill is a 2-second grade, or comes back within 2 seconds. Alright, can we do some range of motion? So I'm going to have you just move your arms and your neck and your wrists, and then could you move your legs up and down and your ankles? Alright, so patient is able to do range of motion on all extremities. Alright, so now could you push your hand against push your head against my hand and put your arms up, push and pull, and then push your legs and pull back. So strength of all extremities is equal bilaterally. I'm going to inspect for edema, tenderness. Do you feel any tenderness at all?
No.
Alright, just let me know. Temperature is warm. No presence of edema on all extremities. Alright, now I'm going to assess your reflexes. Alright, can I see your arm? Okay, so I have your brachial radialis. Your bicep. Tricep. Patellar. I have your popliteal. No, Achilles, sorry, Achilles. And your plantar. Alright, so all reflexes are intact. Now I'm going to feel your pulses. So I have your radial, equal bilaterally plus 2 grade. Brachial, equal bilaterally plus 2 grade. Popliteal, equal bilaterally plus 2 grade. Posterior tibial, equal bilaterally plus 2 grade. And dorsal pialis, equal bilaterally plus 2 grade. Alright, I'm going to inspect your head. Any tenderness at all?
No.
Okay, so no bumps, lesions, parasites, and hair distribution is appropriate for age. Could you close your eyes for me and tell me where I'm touching? Forehead, nose, cheek. Alright, so cranial nerve 5 is intact. Could you smile? Raise your eyebrows. Puff out your cheeks. And cranial nerve 7 is intact. Alright, if you could just look at me. And could you follow my finger with just your eyes? Alright, so cranial nerve 3, 4, and 6 are intact. Eyes are reactive to light. The sclera is white, no signs of discharge. And could you look at the hanger for me?
Sure.
And then focus on the light, or the pen. And eyes are able to accommodate and are equal in pupil size. All right, so now we're gonna cover up your right eye. All right, tell me when you see my fingers.
I can see them.
Okay, now your other eye. Tell me when you can see my fingers.
I can see them.
Okay, so cranial nerve 2 is intact. Could you open your mouth? Say ah. All right, and swallow for me. Okay, cranial nerve 9, 10, and 12 are intact. Gums are pink, tonsils are at a grade 0, and teeth distribution is equal. All right, now I'm going to inspect your nose and your ears. Okay, so nose has a moist mucous membrane, and ears are have equal cerebrum and no excess discharge. Could you close your eyes and tell me which ear I am rubbing in?
Left.
Great. Cranial nerve 8 is intact. Could you shrug your shoulders for me and push against my hand? All right. So cranial nerve 11 is intact. All right. Now I'm going to assess your lymph nodes. So I have your submantle, submandibular, preauricular, postauricular, anterior cervical, posterior cervical, occipital, and subclavicular. And did you have any tenderness at all? Nope. So lymph nodes are non-tender, soft, and movable. All right, now I'm going to assess your lungs. So spinal alignment is straight. No use of accessory muscles, no labored breathing, and no cough. Rhythm is normal. And I'm going to palpate for tactile firmitis. So every time that I go down your back, could you say the words 99?
99, 99, 99, 99, 99.
All right. And thoracic expansion, could you take a deep breath? All right. So now I'm going to listen to all your breath sounds, your lung sounds. Could you take a deep breath every time you feel my stethoscope move? All right, breath sounds are low pitch, clear, and hollow. So now I'm going to feel your carotid pulses. Carotid pulses are a +2 grade, equal bilaterally. Now I'm going to feel your carotid pulse. Could you inhale and hold? All right, and inhale and hold again. All right, no sign of a brute. And now I'm going to feel your heart sounds. Okay, so I have your aortic, which is your second intercostal space, right sternal border. Pulmonary is second intercostal space, left sternal border. Herb's point, third intercostal space, left sternal border. Tricuspid is 4th intercostal space, left sternal border, and mitral is 5th intercostal space, mid-clavicular line. All right, could you lean back for me? I'm gonna inspect your abdomen, so shape is equal and straight bilaterally. And now I'm gonna listen to your bowel quadrants. All right, now I'm gonna palpate your bowel quadrants. Could you tell me if you feel any tenderness at all?
No.
No tenderness? Okay. So, do you have any issues, when was your last bowel movement?
This morning.
Any issues with that? Constipation, diarrhea?
Nope.
No. Any problems urinating, such as blood or burning, itching?
Nope.
All right. So I'm going to wash my hands, document my findings. Are you in a comfortable position?
Yes.
All right. Well, your doctor will be in shortly. Thank
Thank
you.
you.